Demonstrate now is the day 14, 2-week post-op rehab plan for a cruciate. This is Charlie. Charlie's Tessa's dog, who's one of the nurses, and we're going to talk. He had surgery 2 weeks ago, exactly 10 days?
10 days.
10 days ago, and we're going to talk about exactly what we're doing. When we've been doing a cold pack up until now, directly over the suture line, which we've just removed the stitches here. We're going to use a heat pack from now on, before and after we do any exercises. So you get a wheat bag, chemist, put it in the microwave for about a minute, test it on your own skin. We're going to hold it directly over the knee, like where my hand is. You're going to hold it there for 5 minutes. Okay? I want you to do that before and after we do any of the exercises. Okay?
Okay.
Hold it there. If he resists the heat pack, you don't want to use it. Hopefully he'll take it quite nicely. Step 1, joint compressions. Now you've been doing this already up until today, but what we need to do is we want to try and flex the knee joint, compress the knee joint to get the nociceptors, which are the receptors inside the knee, working properly. Grab above and below the knee, and all you do is nice, gentle push together. It seems like you're not actually doing much, but you by just little minimal compressions, you're actually working the joint. Grab above and below and push. You'll find that depending on where you put your hands, he'll be more comfortable. Perhaps he might be more comfortable lying down. Gentle pressure, squeeze and push together. Okay? What that's doing is getting the joint compression and the fluid moving around the joint.
And how many of those do we do?
We want to do 20 movements at least twice a day. If you can do it 3 times a day, that's beneficial.
Yep.
So grab above and below, 1, 2, 3. The second thing that we want to then start to do is some passive range of motion. Now the knee joint, if I was to put the knee joint through its full range of motion, it goes to almost 180 degrees back on itself, the top bone, the femur being with the tibia. Okay, and then it extends to just under 180 degrees. Now you can see that we can move the joint quite nicely there, but he starts to resist it as we move out. For the next 7 to 10 days, you need to do passive range of motion. So you're going to the point before he resists. Okay? Close. Open to where he just starts to become uncomfortable. Close. Passive range of motion. Again, 20 movements, 2 to 3 times a day. Don't get him over upset by it. The aim is, again, just to get the mobility and function back into his knee. Now, we also want to start massage, and these exercises should be done in the same order that we're talking about.
Yep.
Massage. You can see how he's standing. If you look carefully, you can actually see his quadriceps muscle group, which is the muscle group here, which is inserting onto his kneecap, starting to twitch and fasciculate. I'm not sure it's coming out on the video. But what we want to do is relax that muscle from spasming. He's been unfortunately walking with his legs up, so he's spasming, he's holding the quadriceps tight. So we want to massage. Very simply, after the heat, because the heat's going to relax the muscles, grab these and use your thumb and your forefinger to massage between your fingers. Okay? You can see that sore. I'm just pressing on his muscles. Okay? And the aim is to free those muscles up and make him feel far more comfortable. Okay? Again, the heat's going to loosen them up first, which we haven't done, and afterwards the heat's going to calm it all down after you've done the exercise. If you've got time, I would think about doing it over the commercial breaks of your favourite half-an-hour TV show. Okay, so you've got 3 about 1 minute, 3 to 5 1-minute commercial breaks, I think, and that's the perfect time to actually massage and concentrate on actually massaging. Okay, if you have TiVoing or Foxtel high definition whatevers, you want to time about a minute. Okay, 3 to 5 times in a row, just to try and constantly get the nice relax. Then we want to stretch. So after we've done this warming up, we've got the leg working, we need to then stretch. Now this is going to be quite sore because he's quite tight, but a stretch for the quadriceps, and we're talking about doing the quadriceps, is putting your hand over his knee and pulling him back. Okay? And you want to extend it until he's starting to get sore. I'm going to demonstrate, just swap sides with me, Tess, come over that side. I'm going to demonstrate what he can do on his other side. Okay? Once he gets used to what I'm doing, we can actually bring it almost all the way back to 180 degrees. The aim on this side, swap back sides with me. The aim is to be able to do that on his surgery leg. So we want to bring it back, and he's going to be sore there. Okay? And you want to try and bring it right back. So in essence, the leg is at 180 degrees.
Yep.
Does that make sense?
Yep.
Over the next 7 to 10 days, we should be able to do that.
Okay.
All right. Next up is some leg stands. All right. So what we want to do is try to strengthen him through that leg. Okay. And he's trying to shield it. Very simple. Hold his left leg off the ground. Okay. So he's just standing on that leg. As we move on and he starts to do quite well, we're going to start to push him across on that leg. Watch what happens. See how he's starting to try to stabilize? Okay. And he's actually doing that quite well, so you can probably start doing that. If you shift off balance, he's trying to strengthen his core muscles, okay? The strength in the core to try and take the pressure off this leg, and that's what we aim to do.
Yep. Okay.
Now, you remember when, you remember that when he was sitting, when he first originally did his cruciate, he was sitting with his legs straight out.
Yep.
You can see that it's actually coming and tucking straight back in there already, which is really good.
Yep.
How good is his sit and stand? This will test you as one of my nurses.
Okay.
Charlie, sit, sit, got a treat, sit, sit, good boy. See how he sat perfectly? Okay, now he's allowed to put on a little bit of weight with this exercise, but you're going to reduce it from his dinner so he doesn't get too fat. I want him to sit and stand multiple times. So use multiple treats, okay, push him up, okay, sit, good boy. Purely that movement, you can see what he's actually doing. If you watch what he's doing, and Sonia, do you want to just come over to the side? Watch what he does here. Charlie, sit, sit, sit. Okay, see how he kind of flops down? He quick trying to shift the weight off that left leg, off that right leg. The aim is eventually he should start to slow down like a normal dog and sit down by taking the weight through the quadriceps as opposed to trying to miss it. And obviously he's sitting incredibly evenly, which is exactly what we expect. We actually sometimes diagnose the cruciate ligament by what we call the sit test, because they'll sit with their legs out, splayed out on the side. Okay, so that's about it for the next 2 weeks.
Okay.
Okay,
Yep.
Thank you very much.